Ideally, a person's entire healthcare team should work collaboratively to ensure the best care for every patient. When a patient suffers from a disease or condition which has an overall impact on systemic health, such as multiple sclerosis, known as MS, a dental hygienist should work with other healthcare professionals and discuss the impacts and work together to form a treatment plan that will provide the best outcomes for the patient. I chose to interview a nurse practitioner as they are medical professionals who serve a great number of patients in today's medical environment and often act as primary caregivers in rural communities. In this presentation, I will discuss the interview conducted with Sam Arnold, MSN, FNP, BC. Sam began his nursing career at UVA Acute Care RN Acute Service for 2 years and then transitioned to home health services with Augusta Health as a care manager for 10 years. During his time in home health, he was my grandmother's home health nurse after she suffered a ruptured appendix and had to have emergency surgery. During that time, he completed his MSN degree from UVA and began working on his family nurse practitioner certification. In 2014, he started a position with Carilion Family Medicine, Fort Defiance, as the only FNP in the practice along with 3 other physicians. He is my primary care provider as well as my family's. His medical assistant is my aunt, and he graduated high school with my dad, so we have a lot of connections. Through email, I conducted an interview consisting of 12 questions related to the role of a nurse practitioner and specific recommendations regarding the treatment of MS related to dental treatment. Unfortunately, due to COVID-19 limitations, including the fact that Sam indicated that he had a heavy caseload and not a lot of time to commit, I was unable to conduct an in-person or phone interview. He preferred to do the interview through email. It would have been more ideal to have a personal conversation and to be able to ask follow-up questions, but because of his time restrictions, that was not an option. In practice, I would hope to communicate through phone calls with other healthcare providers, but realistically, electronic communication is also likely in patient care coordination. To give you a little background on MS, it is classified as an autoimmune disease that destroys the protective coating of the nerve fibers called the myelin sheath. MS is a chronic illness, and many primary care offices rely heavily on nurse practitioners to manage chronically ill patients after specialists have been consulted regarding treatment plans. When asked what causes MS, Sam responded that it is caused by immune-mediated inflammatory demyelinating disease of the central nervous system. He communicated that there are no clinical findings that are unique to MS. Some conditions, he said, are similar to MS include Lyme disease, migraines, spondylopathologies, and neuropathy. Common manifestations of MS includes sensory symptoms in limbs or face, unilateral vision loss, acute or subacute motor weakness, diplopia, gait disturbances, and balance problems. Treatment of MS is dependent upon the type and progression of the disease. Typically, a nurse practitioner, upon suspected MS diagnosis, would refer the patient to a neurologist who would manage a patient's disease in coordination with the family practice healthcare providers. Complications of MS depend on the type and progression of disease, but in general, there is a slow degradation of bodily functions which are highly variable. MS does not have a cure, but patients may have relapsing and/or progressive disease. Mortality due to MS is difficult to determine because of poor data collection and reporting. Related to specific effects of MS on dental health or treatment, Sam responded that MS patients may be at an increased risk of dental diseases due to reduced manual dexterity. Recommendations for treating patients in the dental hygiene setting include anything that would help patients improve their physical dexterity. Perhaps an oversized handle for a toothbrush or electric toothbrush, or a water pick for their gums if they are physically unable to handle one. Knowing more about MS in general is helpful in the dental hygiene practice, and Sam's recommendations and insights for dental-specific treatment were valuable. Dental hygienists play an important role in educating patients and other healthcare providers regarding the impact of oral health on systemic health, and can also learn much themselves through collaboration with patient's entire healthcare team when a patient presents with a condition or a disease.